Hello, class. In this video, we will be speaking with Stephania Olamendi, who works at Cope Health Solutions. Stephania, can you go ahead and introduce yourself?
Absolutely. Hello, everyone. I'm so excited to have the opportunity to be speaking to all of you. My name is Stephania Olamendi, and I am a regional manager working for Cope Health Solutions. And Cope Health Solutions is a healthcare consulting firm, but one of the lines of services that we offer are these educational programs that you'll hear me speak about today. So a little bit of background about me so that you know who you're talking to. I have a background in public health. I was very fortunate to go to UCLA with Erin a few years back, right, Erin? We graduated, what, 2015?
Yes, it's been a while.
So my concentration while I was in my MPH was environmental health sciences, and I was particularly interested in the built environment and health and really understanding the intersection of community health, the environment in which we live, and health outcomes. So the work that I'm doing right now with Cope Health Solutions includes running our multiple educational programs for pre-health students. I'm also supporting with launching a few new programs. You'll learn a little bit more about our Care Navigator program, which focuses on population health strategies and care coordination as a line of education for students interested in that field. As well as launching our Licensed Nurse Scholar program, which is for nursing students that are ready to find a full-time job. So I've been with the firm for about 3 years. It's been a really fantastic experience, and I've had the privilege to work with so many different students. And my favorite part about what I do is being able to see students at the very beginning of their career and seeing them blossom and get into nursing school and medical school and PT school and really seeing them live out their career dreams. So very fortunate to be in the role that I am, and I'm very excited to speak more about this to you and be a resource for you as well.
Awesome. Thank you so much. So just to segue a little bit into the context of this week. So they've been learning a lot about the different careers that are out there, preparation for graduate school, but this week is really about what kinds of things can they get involved in to get those experiences. So I'm really excited to hear you describe the different programs available at Cope.
Fantastic. Well, I will get started, and Erin, feel free to stop me at any time, and I'll be mindful about pausing and kind of catching my breath in between.
Sounds good.
Okay, so I wanted to start off by listing a set of programs that we have. So as I mentioned in my intro, the Cope Health Scholars Program are an opportunity for students interested in the healthcare field to really understand what it's like to actually interact in a healthcare setting. A lot of you may be interested in clinical careers. Some of you may be leaning more toward public health careers or social work. And I think one of the great things about healthcare is that it is so broad and diverse. It's not just a clinical career. And I'm hoping that this presentation can give you a little bit of an understanding about the different possibilities for you out there. What our programs do that I think is really unique is that it places students directly in patient care settings as well as inpatient care teams so that they understand what it's like to provide care and what it's like to interact with patients and interact with staff before they actually commit to that career path. We have our, the programs that I'll really focus on are the Health Scholar and the Care Navigator program, because I think that those are the most relevant for you at this time. But as I mentioned earlier, I am more than happy to dive into any other programs. If you send me an email and you'd like to know more about it, I'm more than happy to follow up on that. So the Health Scholar program is intended to be for college students, and it's an opportunity to observe and also be hands-on with patients. You in this program will learn how to build that bedside manner if you're interested in a clinical career. There are also healthcare administrator positions or placements that you may participate in so that you can understand what it's like to be in that healthcare admin environment and identify which might be a better pathway for you. Our Care Navigator program exposes college students and college grads to careers outside of the clinical setting. So careers within population health, careers within coordinated care. Something that's really exciting that's happening in healthcare right now is we are making some big strides and big changes in terms of how we handle community health and population health. So as a future professional, it's very important for you to have that baseline understanding of what are those big changes that we're making so that you can be better prepared to be able to provide care for your patients outside of the hospital setting if that's something that you're interested in. But it really helps put all the pieces together and helps you understand how the social determinants of health are factored into providing care. So that's a little bit about the Care Navigator program. The other programs that you see on here, we have pre-med programs that pair up MCAT preparation courses with the clinical experience, and we have that over the summer or over the winter. So those are options for you if that's something that you're interested in as well. Erin, I'll pause there quickly to see if I need to provide any clarification on the programs or if we're good to go.
Oh, that makes sense. And I'm glad that you mentioned the social determinants of health. That is something that we discussed early in the class.
Ah, fantastic. Good, good. Okay, so who, what, where in terms of the Health Scholar program. So our Health Scholars are students, most of them are college students, either early in their college experience or later in their college experience that are interested in learning more about careers in healthcare. We do also have a lot of students who recently graduated and this is their gap year experience. We also have a lot of folks who maybe have had careers in other areas that are pivoting back to healthcare or trying to find a career in healthcare because of all the changes that are happening in the industry. So we have a lot of very diverse individuals in our program, which really makes it a fantastic experience for everyone. So while you're in the program, you are enrolled in what we call our UCLA certified program. So we work closely with the UCLA Executive Program in Health Policy and Management, and our students receive a certificate of completion from UCLA exec programs once they complete the program requirements. All of our students are screened via an application, interview, health screening, and there are trainings and exams that are completed as well. So the reason why this process is so rigorous is because you are essentially getting onboarded to the particular hospital or health system. So you are going through the same process in terms of screening and requirements, immunization requirements that any employee would be subject to meeting, and that's because you are going to be very hands-on with patients. So that's a really big difference with us and any other hospital volunteer program. So to graduate from the program, we ask that you complete 280 hours of clinical experience, and the training experience that you complete does count toward your total. And we're asking for a commitment of a minimum of 1 4-hour shift a week. We have shifts on the weekends, mornings, evenings, afternoons. So we're very flexible with our scheduling because we know that we have such a diverse pool of students and we try to accommodate everyone. We do have different different program paths. We have a 15-month program that allows you to finish your 280 hours in a little bit over a year. We also have our 9-month and our 3-month program, which allows you to finish your required hours in a shorter amount of time, but it does require more shifts per week. So there's a little bit of something for everyone. If you are looking to graduate soon and apply soon, the 3-month program might be a better option for you because you're completing everything in 3 months. It's a lot of work at the beginning, but a lot of our students find that this is a really good option for when they're getting ready to apply to school and are toward the end of their college experience. I've already talked about the purpose and what the program is about, but there are a couple bullet points here that you can reference. One that I specifically like to highlight is connecting students with entry-level positions within the hospital or health system. I know that a lot of times we know that we have medical school ahead or nursing school ahead. But this program allows you to build those connections so that you can potentially get paid for the position that, or get paid for that gap year and get an entry-level position and continue that clinical experience, but still get paid for it. So this is a really great platform for you to utilize and identify that, the resources and kind of build that network within the hospital system. One piece of advice that I have found in my years working in hospitals and healthcare systems is that the industry is very, very, very small. So a lot of times I see folks that used to work at one hospital and they're now at another hospital, and then they used to be the director of the previous hospital. So everyone's really, really well connected. So this, again, is a good opportunity for you to begin to build up that network and build a brand for yourself, because it's likely that you'll see some of these folks in other times of your career. So something to keep in mind. So where you're providing the support: inpatient clinical areas, ambulatory settings, as well as administrative areas, as we mentioned. So for requirements, we ask that everyone is 18 years or older. We ask that you are accepted or currently enrolled or graduated from an accredited 2-year or 4-year university. And as I mentioned, we'll do health screenings, we'll do a background check. This is all a requirement of the hospital. And for people that may not have a social security number, we are able to run background checks without a social security number. And that's something that I'm happy to kind of walk you through if you have any questions about that. We also ask that you have active health insurance. The reason that is the case is because you are going to be working in a hospital setting and you're not going to be under the contractor insurance for the hospital. So we ask that you make sure that you have your insurance in case anything happens. And although people say, I never faint, I'm good, sometimes when you see blood or an IV insertion, you might faint, and hopefully this doesn't happen to anyone, but I've seen it happen. So we just need to make sure that you have an active health insurance. And the question that I get the most often about this is, does school insurance count? And the answer is yes. Okay, program commitment. So as I mentioned, we ask that you commit a minimum of 4 hours a week. If you kind of map out everything that you do in one day, I think 4 hours is not that much, especially if this is really the experience that you need to figure out if healthcare is the right experience for you. What I always tell my students is, if you find that those 4 hours become really tedious and you're not looking forward to them, I think that's a point for kind of pausing and reflecting to see if this is really what you like to do, or if this is really the program for you. But I always encourage everyone to take some time to stop and reflect when you feel like you're kind of getting too into a routine and forgetting the reason for why you're doing things. So we also have quarterly program meetings. These quarterly program meetings happen in person, and this is when we provide you with some educational information that complements the hands-on experience that you have. So we are launching a learning and educational series that is going to focus on giving our students a strong baseline understanding of healthcare. So we have a lot of leaders in the industry coming into our program meetings and giving lectures on what is population health, what is managed care, what happens after a patient leaves the hospital, how can we continue that care for them outside of the clinical setting, what is the burden of care, what are some of the updates to behavioral health policies, and what is Medicare, what is Medicaid. So this happens during these quarterly meetings, and we're really excited to be launching this across all of our 22 sites, and it's something that our students really wanted, so we're excited to be able to present that to them. We talked about the 280 hours to complete the program, so that's a requirement across the board. And then there is a tuition fee, which I'll speak to at the end, and I'll speak to opportunities to get some financial support if that's something that is needed. Okay, I'll pause there. How am I doing, Erin? Any questions?
No questions. It
Okay.
just sounds like an amazing program that just keeps getting better.
Good. I know it's been a while since we've last spoken about the program, so I think you're getting some updates too.
Yeah.
I'll dive into talking a little bit about our curriculum. So our curriculum is really unique in that we have lectures as well as hands-on patient care training. So some of our lectures that we cover include intro to U.S. healthcare, include infection control, customer service, and really how that relates to providing care for patients. We talk about HIPAA, confidentiality, the confidentiality of patients' information and how to safeguard patient information. We also teach you how to provide those basic comfort care skills. So for example, we teach you how to take vitals. We teach you how to ambulate a patient and what to do in case they fall. So these are key things that I think give you a head start if you are interested in a nursing career, because this is something that you'll be learning as well when you're in nursing school. So you'll be very well prepared there. We do have written exams, so we need to make sure that everyone has a level of competency before they're hands-on with patients. So we do have a written exam, and we also have a practical exam that tests your critical thinking in situations that may arise in the patient care setting. So we want to make sure that you feel comfortable in navigating situations and that you have the competencies to do so. And what's important is that there is always ongoing education. So I mentioned the opportunities to learn more from experts in the industry, but also on a rotational basis, you have the opportunity to adjust your placement. So before you're placed in a new department, in a new area, you will have to receive some training. So again, you can meet certain competencies that are important to the unit. So the educational component never ends, which I think is great. Okay, so I want to talk a little bit more about our tier system. So this gives you an idea of what may be some of the departments where you can shift and what may be available to you. One disclaimer that I'll make is that this is kind of our general tier system, and that the tier system across different hospitals may be very different. So if you don't see something on here that you're really excited about, I would recommend that you reach out to me and you let me know, hey, I'm really interested in healthcare admin, but I don't see an admin department on the tier system. What sites may have a more robust healthcare admin program? And I'm more than happy to connect you to the right folks to talk to. So the idea behind this tier system is that we start off with your introductory floor so that you can get used to kind of the patient care setting. For a lot of you, this may be the first time that you're in patient care settings, and it can be a little bit scary at first. There's a lot going on. There's a lot of alarms, a lot of codes. There's just a lot of motion. So a starter floor gives you the platform to learn and to begin to build that confidence in interacting with patients. As you go up in the tier system, the required hours that are needed for each tier system increases. So does your comfort in the role, and so does your comfort in the patient care environment. So by the time that you get to tier 4, and some sites even have a tier 5, these are the departments that are probably have the highest risk in terms of the patient population, maybe a very sensitive environment like the operating room, labor and delivery. But by then, you've really built a strong understanding of the program, and you understand what you want to get out of the program. So we reserve those departments for students that are a little bit more seasoned to make sure that they are not only having that good experience and really reward them for their tenure, but also that you have a good understanding of where you're trying to head toward in healthcare. So these are some of the benefits of our program. You are eligible to receive a letter of recommendation once you complete the requirements. You do receive a certificate of completion from the UCLA Executive Programs in Health Policy and Management, and you get to join a network of I would even say it's over 35,000 alumni by now. We have a really unique platform called Cope Connect, where our students that recently graduated or have graduated a really long time stay connected and attend events and really support folks that may be fresh out of school and support with finding a mentor or finding a job. And they really help to help connect the dots for students, which I think is really fantastic. And I think more than anything, one of the benefits that I see is that you are learning how to be in that setting. A lot of times we commit to something, but we don't really know what's on the other side. So this gives you an opportunity to kind of test it out and see, okay, do I want to have a clinical career? I might not. And maybe once you're in the setting, you realize, I really don't want to do this, but social work is something that interests me. And maybe you were able to spend some time with social workers and talk to them. So this really gives you a great platform to do that learning and to build that network. Okay, I'm going to dive into application and onboarding process. So as I mentioned, we do have an online application, and you can find the online application on our website. It's the same application for any of our programs. We also will do a general orientation. So we'll bring you in for an interview and orientation. And this is where you get to interact with some of our students, learn from their experience, and hear from them. And then we'll do a health screening and a clearance. We'll go through all the details of what you need to bring, what your requirements are, and then we invite you to attend our 30-hour training. And one of the great things that we're adjusting right now is we are partnering with a couple sites, a couple other Cope Health Scholar sites, so that we train together. And one of the great things about doing that is you are, again, expanding your network, connecting to different students that may not be shifting at your same hospital. And we've also have intentionally put some of our lecture material into modules so that we can use the in-person time to run activities and to kind of help you connect the dots and give you more context for the lectures that you may have reviewed on your own. So that's an exciting change that we're doing this February and beyond. So I do want to point out that we do have a lot of sites that we're partnering with, and we're so excited and so fortunate to be able to be growing so quickly and to be interacting with so many students across the West Coast. We recently launched a site in Hawaii, which has been really fun and really exciting to see just how great it's been received in the island, and just how many wonderful students we have over in Hawaii as well as the Washington area. And we're excited to continue expanding. We're excited to potentially bring the program to the East Coast, bring the program to the Midwest, and the sky's the limit, and we're super excited that it's been really well received. So Erin, I want to ask if you would like for me to talk a little bit about the CareNav program. I want to be mindful that we're a little bit out of time, but I just wanted to check with you. I can quickly go through this if you'd like.
Yeah, I think if you could just give a quick overview about it, that would be helpful.
Absolutely. Okay. So the Care Navigator program, as I mentioned, is more focused on population health and more focused on care coordination and the social determinants of health. So what does that mean? That means that our students have the opportunity to understand healthcare from a different lens. So while our Health Scholar program is more focused on the clinical setting, the Care Navigator program is focused on understanding how care is coordinated outside of the clinical setting. So in the hospital, you have care managers, you have case managers, you have care coordinators, you might have patient coordinators. They're called very different things, but their role is to support patients with exiting the hospital and with connecting them with resources and appointments and any sort of equipment that they might need to once they leave the hospital. So this role is for students that are wanting to learn a little bit more about healthcare delivery from a different perspective. Again, you may be working in clinical settings, but you're not going to be responsible for taking someone's vitals. You might be responsible for calling their primary care provider and confirming that they are scheduled for an appointment after their surgery, or you might be responsible for referring a patient to a skilled nursing facility after they exit the hospital, or you might be responsible for providing some educational resources for them for their diabetes or for their chronic heart condition. So really unique role, a little bit different than our Health Scholar program, and I do want to highlight the core curriculum for our care navigators. So during training, we talk a little bit about the healthcare landscape. So after you've received a baseline understanding of the healthcare landscape, we talk a little bit about what are some of those changes that are happening in the healthcare landscape. So a big one that is really important right now in the industry is how hospitals are being reimbursed. And I know that for a lot of us, we don't really think about that, and it might not be something that you think you're going to be impacted by, but as clinicians, it's important to know what are the payment models that are being implemented at your hospital where you work, because what that's going to tell you is some of the initiatives that are going to be asked of you to comply, a lot of times have to do with how the dollars are being funded to the hospital. So it can get a little bit complicated, but I think giving you a general understanding of that and how we're shifting toward a more holistic approach of providing care is a really great background to have as you're getting ready for interviews or you're getting ready for applying to schools. It's a good context to have. We'll talk about patient engagement, chronic conditions. We'll give you basic on documentation. In the care navigator role, you do assist the patient care team with documenting in the electronic medical record, which I think is a great entry level opportunity for you to know how to do that and the importance of doing that. We talk about social determinants of health, integrating care. So that's another big area that is happening in healthcare, is how can we shift toward a more integrated care model, so similar to Kaiser, if you guys are familiar with, where everything is under one roof and where everyone speaks the same language in terms of your electronic medical record, your insurance, and all of that. And then there's a couple other lectures on behavioral health as well. So to close off, primary activities, so our care navigators fulfill different tasks around care coordination, around health promotion, follow-up appointments, which are really important and a great way to connect with patients and ensure that they're staying healthy. Care transitions, so transitioning a patient from hospital to maybe a skilled nursing facility, patient engagement, and then those community referrals and leveraging the community resources and really showing what resources are available to patients once they leave the hospital. So really exciting. You can tell that I'm really excited about the care navigator role. I've been playing a leading role in mapping out the competencies for our program and our training. So it's been really exciting. One of the things that we're doing more recently is launching our care navigator program at MLK Community Hospital. And it has been such an exciting journey to partner with MLK. They're fantastic, and they're so excited to have our care navigator. So that's kind of a plug for everyone out there. If you are interested in the care navigator role, this is going to be the first time that we have a care navigator role that's really a standalone program. A lot of times in a lot of sites, it's been dependent on our Health Scholar program, but this is the first time that it'll be a standalone care navigator program. And some of the work that you all will be doing at MLK as care navigators is truly phenomenal, and you have an amazing opportunity to really work closely with the community and make a significant impact. So I'll leave the dates and deadlines here. For the Health Scholar program, December 31st is when our application is due, and March 31st is when the next cycle of applications is going to be due. The tuition for our programs, depending on what program you decide to sign up for is between $225 and $495. And the tuition covers your certificate, your background check. It covers your ongoing immunizations while you're here, anything that may need to be updated. It also covers your uniform, and as I mentioned earlier, if you anticipate needing support for the tuition payment, feel free to reach out to me and Erin. I'll give you my contact information and we can have you share it with the students. Our Care Navigator program pilot group is going to launch in April, and we're going to begin collecting applications all this month and next month. And our application deadline is going to be the beginning of February if you are interested in joining the pilot cohort at MLK. So I will pause there. Erin, let me know if I missed anything or if there's anything that I need to clarify.
No, I think you did a great job of explaining the different options, and it's clear by the passion in your voice that you really care about this work. And I think a lot of what you describe in both programs aligns well with what we've been covering in this class. So I really hope that our students will take advantage of this opportunity to get their hands-on experiences through COPE.
Good. Yeah, I hope to get emails from you. I do mean it. I'd love to not just be a resource for you in terms of the program, but a resource in general. I think I've had a really interesting journey throughout my life, and it's been fun. But I can definitely share a few tips and tricks and lessons learned along the way. So more than happy to provide or to be a resource for anyone here. And I'll give you my contact information, Erin, and I'll also send this to you. But yeah, it's been fantastic. I am so excited that, Erin, you offered this opportunity for me to talk to your students. I hope we can do this again. And yeah, thank you so much for having me.
All right, thank you.